I will be talking today about the treatment of problem behavior using functional communication training. Functional communication training is one of a number of function-based treatments. Function-based treatments are ones that try to understand and treat problem behavior in its environmental context. And to explain that, I have a little story I like to tell. There was a man walking in the woods, and he came upon this object, picked it up, started rubbing it, and it turned out to be a bottle, and a genie pops out of the bottle and says, "I've been stuck in that bottle for 3,000 years, and for your reward for releasing me, I will grant you any 3 requests you want." So the guy thought long and hard, and he said, "Well, you know, my health's been kind of bad. My heart's bad, my knees are bad, I feel pain all the time, I can't seem to get up enough energy to do things. It'd be kind of nice to feel good for a change." And the genie goes, "Poof, your wish is granted. What's your second wish?" And the man thought long and hard again, and he said, "Well, you know, I've always been really poor, never had any money, never been able to do things, never been able to travel or buy things I wanted. It'd be nice to have a little bit of money." And the genie goes, "Poof, your second wish is granted. What's your third wish?" And now the guy was down to 1 wish, and he really thought for a long time, and he finally said, "Well, you know, it'd be really nice if my sex life would improve." And so the genie goes, "Poof, your third wish is granted." And about a month later, 2 months later, the guy's walking through the woods again, and he happens upon the genie. And the genie says, "Oh, well, how did the wishes go?" He says, "Oh, great, I've just been to see the doctor, and he's given me a clean bill of health. I'm pain-free, I'm running, I'm jogging, doing all sorts of things. I never felt better in my life." The genie says, "What about the second wish?" "Well, apparently I had this rich, distant relative, and I was his only heir, and he's left me all the money I'll ever want or need, and so now I can buy things, travel, do whatever I want." The genie says, "Well, what about the third wish?" He says, "That's the best one of all. I'm having sex every other week or so." And the genie kind of scratches his head and said, "Sex every other week? And no, my wishes usually come out a little bit better than that." And the man said, "Well, it's not bad for a priest in a small town." So the point is that we have to think about and understand behavior in its context, and functional analysis and function-based treatments help us do that. And so that's what I'll be talking about today. So functional communication training is used to treat a wide variety of problem behaviors, such as aggression, self-injurious behavior, inappropriate vocalizations. And it is prescribed on the basis of a functional analysis. And once we understand the function of problem behavior, then we're able to put problem behavior on extinction or see that it no longer produces reinforcement. And then we're also able to use that reinforcer to train up a functional communication response. And so we allow the individual to access that reinforcer through appropriate behavior rather than through problem behavior. And so what you see on the slide here is some of the potential components of function-based interventions. And one of the things that we can do is to provide the functional reinforcer for appropriate alternative behavior, and we do that with functional communication training. We can also provide a competing reinforcer, a reinforcer that is highly valued by the individual that they may prefer over the reinforcer for problem behavior. We may remove motivation or the establishing operation for problem behavior so that the individual is less likely to engage in problem behavior. And we may remove the reinforcement contingency for problem behavior, again, place the behavior on extinction, which is one of the components we do with functional communication training. And then finally, we may remove the functional reinforcer contingent on problem behavior. So rather than, as in the past, problem behavior produced the reinforcer, problem behavior actually decreases access to that reinforcer. So with functional communication training, the individual is taught a communicative response that produces access to the reinforcer responsible for maintenance of problem behavior. For example, an individual whose problem behavior is maintained by escape from non-preferred tasks might be taught to request a break from tasks using an appropriate communication response, such as asking for a break please, or signing finish if they don't speak. And this functional approach to treating problem behavior is different from a more traditional diagnostic and prescriptive approach. So most structural approaches involve looking at a number of behaviors, what they look like, and whether or not they covary. So for example, if a child has significant limitations in communication and social relatedness and has repetitive activities, interests, and behaviors, that might lead to the diagnosis of autism. But simply making the diagnosis of autism doesn't tell us very much about where we should start to intervene. It perhaps provides some broad areas that we need to target, but doesn't pinpoint how we're going to go about intervening with a particular child. We contrast that with a functional approach, where a functional approach is looking at one or a small number of responses at a time, and we're trying to understand the environmental context in which that behavior occurs, and that helps us to pinpoint what we need to do in terms of intervening and developing a specific treatment. So what does a functional analysis do? Well, it identifies the environmental context in which aberrant behavior is likely to occur, when it's likely to be high, and also those situations in where it's likely to be low or at zero levels. It helps us to identify the antecedents and consequences that occasion, evoke, and reinforce or maintain problem behavior, and a functional analysis is used to prescribe effective treatments. Some of the common functions of problem behavior, such as self-injurious behavior, involve social positive reinforcement, where the behavior produces attention from adults or produces access to preferred items or toys. And if that occurs a lot, the individual may learn to display problem behavior in order to get access to those things. Another common function is what we call social negative reinforcement or escape, where an individual may be asked to do a non-preferred task, such as folding towels. And with most of the individuals we work with, we don't teach them a task simply by standing up lecturing like I'm doing right now. We literally may get behind them and take their hands and say, this is how you fold the towel. And for some individuals, they may not like this situation, may do something inappropriate, knock the materials off the table, try to hit or bite the therapist, or even hit or bite themselves. And the natural reaction of a parent or teacher in that situation is to back off and give the child a chance to calm down. Well, if that happens over and over again, what the child may learn is, if I want these tasks to go away, these people to leave me alone, the thing to do is to hit yourself. Now, most of the individuals that we work with don't think through and plan this like I just explained it. But if they experience that contingency over and over again, they may learn the association and learn to escape non-preferred tasks through problem or inappropriate behavior. And a final function that we typically look at is automatic reinforcement. And the example I like to give about this is just about all of us, if we have discomfort and we have an itch, we scratch it and it feels better. That would be an indication where it isn't the reaction of any other person, it is that the reinforcer is the automatic product of the behavior. And what we see very frequently is individuals who display problem behavior in order to produce sensory stimulation. So for example, individuals who have very limited visual acuity, who maybe not be totally blind, but are blind or close to blind, but have intact neural pathways, we see lots of self-injurious behavior directed toward the eye. And why is that? Well, just about anybody, if you press or push on your eye, you'll produce stimulation in the occipital lobes. And for someone who's deprived of sensory stimulation all day long, that limited form of sensory stimulation may be enough to direct their self-injurious behavior toward the eyes. And that would be an example of automatic reinforcement. So how do we assess the function of problem behavior? Well, there are a variety of methods. Probably the most efficient and easy to use are called indirect assessments, and these consist of questionnaires or rating scales. They tend to be easy to use, but they also tend to have the greatest problems in terms of reliability and validity. Nevertheless, with some mild cases and some more obvious cases, they can be used and quickly lead to intervention. The next level of functional assessment is called direct observation assessment, or sometimes called a direct or a descriptive analysis. And this involves going and having systematic observations in the child's environment and looking for correlations between certain antecedents in the behavior and between the behavior and certain consequences. And if we see a high correlation, that may suggest that that is the function of problem behavior. So if in the natural environment we see that very frequently self-injurious behavior is followed by attention, that would suggest that perhaps attention is the reinforcing consequence. The one limitation of this methodology is that it tends to produce a fair number of false positives, where we find a correlation, but that correlation isn't actually responsible for increases in problem behavior. And then the final set of procedures are called functional analysis. And functional analysis has two major characteristics. One is that we're going to use direct, reliable observation measures to quantify and measure the behavior. And then the second thing is that we're going to systematically manipulate the variables that we're hypothesizing to be the function of problem behavior. So if we're trying to assess whether the behavior is maintained by attention, in certain conditions we're going to deliver attention following problem behavior. And then in other conditions we're going to deliver attention pretty much all the time, but not systematically following behavior, to see whether it increases in that situation where it produces attention and is much lower in the situation where attention is delivered freely. And so this is the methodology that we use mostly for individuals with more severe types of problem behavior. And there's a fair amount of research on the effectiveness of these procedures for identifying the function of problem behavior, and also for prescribing highly effective interventions. And there's ongoing research to work on making these procedures as efficient as possible, and significant progress is being made in that area, such that the major limitation of functional analysis in the past has been how highly trained individuals have to be to carry out the procedures, and then how long it takes. And we're working on both of those things and making significant progress. And so this is an example of a graph from a functional analysis, and what you see is a series of data points, and each data point represents approximately a 5-minute sample of behavior in which we're testing each of the major hypotheses, whether the behavior is maintained by attention, whether it's maintained by escape from demands, whether it's maintained by automatic reinforcement, or maintained by tangible reinforcement. And you can see in this graph that most of the problem behavior is occurring in the attention condition, indicating that this is a form of problem behavior maintained by contingent attention. And this is just an example of a typical treatment graph. We'll start out in baseline, and what you see in this baseline phase is destructive behaviors occurring at roughly 4 to 5 times per minute. We then introduce the functional communication treatment and extinction of problem behavior, and we have high rates of communication and near zero rates of destructive behavior. We go back to baseline to help show that it is our treatment that's responsible for the reduction in problem behavior, and we see that destructive behavior increases again. And when we reinstitute functional communication plus extinction, clearly we see high rates of communication and again near zero rates of destructive behavior. And this is really our starting point in terms of finding something that's going to work. And then our next important components is we want to make the treatment practical and feasible, such that a parent can implement the treatment in the home, or a teacher can implement the treatment in the classroom or other natural environments. So functional communication training has been used with a fairly wide variety of topographies of problem behavior and also diagnoses. Response topographies treated using FCT include aggression, self-injurious behavior, property destruction, other forms of disruption in the environment, elopement, inappropriate sexual behavior, and inappropriate vocalizations. And this treatment has been used with a variety of diagnoses, including autism, intellectual disability, attention deficit hyperactivity disorder, traumatic brain injury, and speech and language disorder. And when trying to decide when FCT is appropriate, it's important not only to think about the type of behavior, its topography, but also the function of problem behavior. So FCT is probably appropriate for most forms of problem behavior, at least outward forms of behavior that we can measure. But it is most appropriate for behavior where the function is maintained by social consequences. So behavior maintained by attention, escape from demands, tangible items, it's very appropriate. For other functions, such as automatic functions, it is less so. And it's also important to distinguish topography from function. So it's possible to have two topographies of self-injurious behavior, and both of them might have the same function, both maintained by, say, escape from demands. And in that situation, then one form of FCT would be appropriate for treating both of those topographies. However, it's also possible that you have two topographies of self-injurious behavior that have separate functions, say one maintained by attention, another maintained by escape. And in using FCT, we would then have to address each of those functions and have a form of FCT designed for attention-maintained behavior and another for escape-maintained behavior. So what are those appropriate functions? Well, as I said, FCT is most appropriate for problem behavior reinforced by social consequences such as attention, escape, and tangible reinforcement. Now, FCT has occasionally been used successfully with responses maintained by automatic reinforcement, but it is often difficult to manipulate automatic consequences. So if a behavior is maintained by sensory stimulation, such as head banging producing kinesthetic sensation, sometimes we can apply a helmet or put them in situations that mitigate that sensory consequence, but it's often difficult to eliminate it totally. We can also do things like response blocking to prevent the response from occurring. So it's difficult to implement extinction of automatically reinforced problem behavior, but it's equally or sometimes more difficult to then provide a similar or the exact type of sensory stimulation with an FCT, following an FCT response, because other people typically don't control the reinforcers that are delivered automatically from as a response product of problem behavior. So other assessments that may be needed as adjuncts to functional communication. Well, one thing is it's very important to do a risk assessment before beginning a functional assessment. Also, medical assessments may be needed to identify co-occurring behavioral health disorders that may affect treatment. Example would be major depression. Medical assessments may also be needed to identify associated medical conditions, such as earaches, headaches, detached retinas that may occur from head banging, or concussions that may occur from head banging. And so we want to make sure that those things are addressed as well. And also in such cases where the behavior is dangerous, we want to have medical input into our risk assessments. So what do we typically do with most cases for a risk assessment prior to a functional analysis? It's important to interview caregivers to determine how often and under what conditions problem behavior has resulted in physical harm to self, others, or the environment. And that, asking about, has anybody ever gone to the hospital as a result of this behavior? Have they caused tissue damage? Have they caused cuts, bruising, any concussions? We also want to know whether or not the individual engages in self-injury or aggression towards delicate body parts. Okay, so individuals that may engage in eye gouging, and those types of behaviors, even when we're doing the functional analysis, we want to either have protective equipment that's going to eliminate that dangerous topography, or we want to block those topographies and conduct the functional analysis focused on other less severe forms of self-injurious or other behavior. For some individuals, a padded treatment room or protective equipment may be needed as a part of the functional analysis. And it's real important to have very clear criterion for terminating sessions. So we typically start out with if either the individual is harming one of our staff, putting them in danger, if the individual is engaging in self-injurious behavior that's producing reddening of the skin or bleeding, we're going to stop sessions at that point and problem solve on how we can come up with a safer way to get the same information on the function of problem behavior. Now, another important thing to determine is whether or not functional communication training is the most appropriate operant intervention or treatment. As we've said, functional communication training involves a delivery of the functional reinforcer contingent on a communication response. The most common alternative approach would be non-contingent reinforcement, or NCR, which involves the delivery of the functional reinforcer on a time-based schedule. So very regularly, the reinforcer that previously reinforced destructive behavior or problem behavior, we're going to deliver on a time-based schedule so that they're getting that reinforcer a lot and shouldn't be motivated to engage in behavior in order to get it. And also, we might use competing reinforcers that can be delivered either on a contingent basis, such as based on a communication response, or delivered on a time-based schedule like NCR. So what do we do to determine whether FCT is the appropriate reinforcement component versus non-contingent reinforcement? Well, one question that's important to ask, is it possible to manipulate the reinforcer for problem behavior? And so I already gave the example of individuals with automatically maintained behavior. It's often very difficult to do that. And typically, we would not use functional communication training in that situation. We would use non-contingent delivery of competing reinforcers as our first starting point. A second important question to ask is, are there many times when it is impractical to deliver the functional reinforcers? So if you have a family that is very chaotic, a parent has multiple children, and the behavior is maintained by attention, it is going to be very difficult to expect that parent to deliver the reinforcer on a dense reinforcement schedule, and FCT may not be the most practical treatment in that situation. A third important question is, how dangerous is the behavior? And so really dangerous self-injurious behavior or really dangerous aggression, typically we may have to use other procedures, at least initially, and then perhaps add a functional communication response later in the treatment process. So why would that be? Well, one of the things when we start treating problem behavior is that we're expecting them to emit the functional communication response. And many of the individuals that we work with don't do that automatically. We can't just tell them, do this instead of your problem behavior, and you'll get the reinforcer. Some kids we can, many we can't. And so we have to prompt them to do the functional communication response, and they have to learn it and use it in place of this behavior that's had a long history of reinforcement. And in that situation, we may prompt them, try to get them to do the functional communication response. They may not do it, and while that's not occurring, they're being exposed to the motivational or establishing conditions that are likely to evoke problem behavior. And if the behavior is real dangerous, we don't want them engaging in that. And so a approach like non-contingent reinforcement, where we can deliver the reinforcer frequently and reduce motivation for the behavior, that may help prevent extinction bursts that are likely to occur early in the treatment. We also have some procedures that I'll be talking about later to help mitigate that problem with functional communication training so that it can be used more often in those situations. And then finally, we ask, is teaching a communication response an important goal independent of problem behavior? So many of the individuals that we've worked with come to us with very, very limited and sometimes no vocal or no non-vocal MAD repertoires. They don't sign, they don't point, they don't tell us what they want, and so they don't have a repertoire with which to request reinforcement. They primarily use their problem behavior. And so for those individuals, it may take a little bit longer to reduce problem behavior using functional communication training, but it may be very important to start to establish that communication response in terms of the long-term effectiveness of the intervention. And so simply presenting the reinforcer non-contingently may reduce the behavior immediately, but over the long term, establishing that communication response is likely to have a sustaining effect on reducing problem behavior. Okay, so some of the unique features of functional communication training. Well, it is a DRA procedure, or differential reinforcement of an alternative response. And it is unique in that it specifies its reinforcer. That is, the functional communication response is a man specifying the reinforcer that previously reinforced problem behavior. We want it to require minimal effort. We want it to make it very, very easy for the individual to do the response. And at least initially, we want to reinforce it on a very dense schedule, usually an FR1. That is, it works like magic. Every time the individual emits the functional communication response, we want to deliver the reinforcer. And hopefully, once taught, the response is something that's recognized by a wide variety of people so that the individual can recruit reinforcement across a variety of individuals and environmental contexts. Now, because of the ease and consistency with which reinforcement can be obtained during functional communication training, some authors have suggested that the client controls the delivery of reinforcement. In addition, Carr and Duran have suggested that control over reinforcement may contribute to the effectiveness of FCT. We've done one, and others have done another investigation, and found that non-contingent reinforcement, which clearly the individual does not control the schedule of reinforcement, it's based on time, and FCT, which does, produce equivalent reductions in problem behavior. So both treatments work about the same, at least when they're initially introduced. Nevertheless, what we found was that participants preferred FCT over NCR when given a choice. You can have this treatment or that treatment. And so given that having individuals, especially those with limited communication, giving them multiple choices is an important goal in and of itself, FCT probably is the preferred intervention in most cases. Okay, so what else? Well, as we said, functional communication training may promote generalization and maintenance because the communication response may prompt both trained and untrained caregivers to deliver the reinforcer at appropriate times and for appropriate behavior. Now, there are also a number of limitations of functional communication training, and that's been the focus of our research here for some time. How do we deal with these limitations? So one limitation is that teaching the functional communication response may evoke problem behavior. And this is particularly true if the behavior is maintained by escape from non-preferred tasks, because when we ask or place the demand on the child to emit the functional communication response, that's one more demand we're placing on them, and that demand itself may evoke problem behavior. A second limitation is that individuals may display the functional communication response at exceedingly high rates, requesting a break from every single school task, requesting constant attention from an adult, requesting to be the only one that plays with the family computer or iPad. And so that obviously can be very problematic. And finally, individuals may request reinforcement at times when it is impossible or inconvenient for the caregiver to deliver. So if a caregiver is attending to a sick sibling or an infant sibling, it's going to be very difficult for them to deliver attention to the target child when that target child displays the appropriate communication response. And so we want to develop treatments in which the functional communication response produces reinforcement at certain times, but the individual learns to tolerate periods when that reinforcer is unavailable, and we want them to do that in such a way that that problem behavior does not come back. So how do we select the most appropriate communication response? Well, as I said previously, one important factor is the communication response should be very simple for the individual to do. And the communication response should produce the reinforcer identified during the functional analysis. When we first start FCT, the communication response should always produce that reinforcer. And if the child cannot do the response independently, we help them so that they can do it quickly and then deliver the reinforcer. And this is one way that we've developed to try and limit exposure to the motivational conditions or the establishing operation so that extinction bursts are less likely. The communication response should match the function of the child's problem behavior. So for example, if the child's behavior is maintained by escape from demands, we may teach them to say, break please. If it's maintained by attention, we may teach them to say, play with me please. If it's maintained by a tangible reinforcer, we may teach them to say something like toy please or iPad please. And then for those children who do not speak, we often use a picture exchange or card touch. Well, all they have to do is touch a card, and the card may, if it's attention maintained behavior, the picture may show the child playing with an adult. For escape from demands, they may just touch a card that shows them leaving the work area. For tangible reinforcement, may have them touch or hand over a card that shows them playing with their favorite toy.
Give it to me. Good job touching the card. Give it to me. Good job touching the card. Give it to me. Good job touching the card. Give it to me. Nice job touching the card, Katie. My turn. Nice work touching the card. My turn to play. Good job touching the card, Katie. My turn to play. Nice work touching the card. My turn to play. Good job touching the card. My turn to play. Good job touching the card. My turn. Nice work touching the card. My turn. Good job touching the card, Katie. My turn to play. That's touching the card. My turn. Good touching the card, Katie.
Okay, it's also important to note that when we do functional communication training, we typically combine it with extinction of problem behavior. And it's important to distinguish between different functions of problem behavior because extinction looks different based on the function of problem behavior. So if the behavior is previously reinforced by attention, then extinction would involve no longer delivering attention following the target behavior. If the behavior was maintained by tangible reinforcement, then extinction would involve no longer delivering that tangible item following the target behavior. Those two are pretty simple, but when we think about escape extinction, it gets more complicated. And so when a behavior is maintained by escape from demands, what we want to do is continue with demands as if the behavior never occurred. And for some individuals, this can be highly difficult. So they may do things like throw the materials off the table. If you don't have another set of materials to quickly go on with the next prompt in the sequence, then while you're picking up the materials, they're getting a break from the tasks. And we want to prevent all those potential forms of integrity errors that may allow the individual to access the reinforcer that we want to prevent them from accessing in order to implement extinction correctly. And finally, for behavior maintained by automatic reinforcement, we want to see if there's a way to either mitigate or prevent the sensory consequences of the response. And again, that may be putting on padding or protective equipment, or it may involve response blocking in order to prevent the sensory consequences of the behavior. So how do we address these limitations of functional communication training? Well, that's what I'm going to talk about next. And one is we want to see if we can arrange our stimulus conditions in ways that prevent extinction bursts. And this is especially important during the initial training of the FCR, or the functional communication response. And also a very important part is we want to bring the functional communication response under what we call discriminative control, so that we can signal when reinforcement is available for that response and when it's not. And what we want to teach individuals is to request reinforcement when we signal that it's available. And when we signal that it's not available, we want to teach the child that during those times, they need to tolerate a period where they can't access the reinforcer. And we want them to, when we talk about teaching them to tolerate that, what tolerance means is we want them to be able to not engage in the functional communication response. That is, not nag the parent, yes, I want the iPad, I want the iPad, I want the iPad. And we also don't want the functional communication response to decrease and be replaced by a resurgence of problem behavior. So some of the things that people have done in terms of teaching tolerance for delays or periods where the reinforcer is not available involve signaled and unsignaled delayed reinforcement. And the research is kind of mixed on the effectiveness of that, but in most cases, signal delays are going to work better than unsignaled, but one of the problems that we've noted with delayed reinforcement is over time, and as you make larger and larger delays, the response tends to weaken, and so you lose, the individual stops emitting the functional communication response. A second procedure involves presenting activities or alternative reinforcers during the reinforcement delays. And what do we mean by that? So if we have a behavior maintained by adult attention, and the adult, say mom's going to make lunch, providing the child with a highly preferred toy, say the iPad or watching a favorite movie, during that time may decrease motivation because the child is going to engage with this alternative reinforcer rather than engage in attention-maintained problem behavior. And then finally, the place where we've done the most research is in using what we call multiple or chain schedules, where we alternate periods where the functional communication response produces reinforcement and periods where it doesn't, where the functional communication response is on extinction. So what are the steps involved in developing a multiple or chain schedule? The first thing is we bring the functional communication response under the control of discriminative stimuli that signal periods in which the functional communication response will and will not produce reinforcement. And so that would be a multiple schedule with periods where the response is reinforced on a FR1. Each time the behavior occurs, it produces reinforcement, and we signal that. And then we have another signal that says, no matter what you do right now, you have to tolerate this period where the reinforcer is not available. And then typically we want to gradually lengthen the duration of the extinction component of the multiple schedule until the level of reinforcement delivery is practical for the home and a classroom setting. So very frequently we end up with a schedule where the reinforcement component lasts 1 minute and the extinction component lasts 2 minutes, and those are alternated in a quasi-random fashion such that the individual is experiencing some periods where the extinction components last a total of 4 minutes, or there's 2 back-to-back 4-minute components and they have to tolerate the unavailability of the reinforcer for an 8-minute period. In one of the first studies that we did to look at this, we delivered reinforcement for the functional communication response on an FR1 schedule in the presence of a discriminative stimulus. In this case, we just had a big picture card on the wall showing the child consuming the reinforcer. And when that card was up and visible, reinforcement was available for the communication response. And when we took that card down and put it out of view, then reinforcement was unavailable. And we alternated these periods. Each period lasted 30 seconds with the card up and 30 seconds with the card down. And this decreased the rate of the functional communication response, the number of times the individual was requesting reinforcement, by 50%, but it was still very labor intensive and not very practical. In this graph, it just shows an example from that study. You see in baseline destructive behavior in the top panel is occurring at about 5 times a minute. We then introduce functional communication training, and also had one where we used a competing or alternative reinforcer, in this case toys. We go back to baseline, you see high rates again of problem behavior, and then back to treatment, and low rates in both treatment conditions. And then in the bottom panel, we show what happens with the communication response. So the squares, both the open squares are for the functional communication training, the closed squares are for the alternative communication training. What you see is the individual very quickly learns to request reinforcement when it's available and not request it when it's unavailable. All the circles represent the times when we're signaling that the reinforcement is unavailable. So the individual is learning to request reinforcement when we signal it's available, and to withhold or not request reinforcement when we signal that it is unavailable. So the next important study in developing the effectiveness of multiple schedules for teaching individuals to tolerate periods where reinforcement is not going to be available in order to make FCT more practical was a study by Hanley et al. in 2001. And what they did was to quasi-randomly alternate between the FR1 schedule and the extinction component, just as we did. And each component was correlated with a specific signal. But initially, the duration of the reinforcement component was 3 to 4 times longer than the extinction component. So very dense reinforcement initially, and then gradually they decreased the reinforcement component and increased the extinction component until the extinction component was again 4 minutes, which produced periods sometimes 4 minutes, sometimes 8 minutes, where the individual had to tolerate the absence of the availability of reinforcement, and then periods of 1 to 2 minutes where reinforcement was available. And this graph just shows the progression that they went through from very dense reinforcement at the top to the final schedule where they're alternating 60 seconds of reinforcement available with 240 seconds where the reinforcer is unavailable. And this decreases the number of times the individual requests reinforcement by about 75 to 80%.
Good waiting. Nice work touching the card. Good job waiting. Nice touching the card, Katie. Nice touching the card. Good waiting. Nice job touching the card. Good waiting. And awesome job touching the card. Nice work waiting, Katie. And good job touching the card. Great waiting, Katie, and good touching the card. Awesome job waiting, Katie. Nice touching the card.
So in that video, you saw someone who picked up the multiple schedule fairly quickly and learned to request reinforcement when it's available and not when it's unavailable. Not all patients or participants learn the response so quickly. And so some of the things that we run into is the individual may take the card and tear it up. The individual may continue to request reinforcement very frequently, both when we signal that it's available and when it's not available. So in the first situation where we have somebody doing something inappropriate, we may do something very simple, like during the initial training, we will tape down the picture card to the table so they don't have that opportunity to pick it up, throw it, tear it up, or throw it under the door so it's no longer in the room. And that also makes it easier for us to prompt the response because it's always in one place. We will do that initially, and once the individual starts to learn that touching this card is a good thing, it produces a preferred reinforcer, typically the problem behaviors tend to drop off, and then we can start asking them to do more complex responses, and that may involve handing over the card. If they're starting to get some language, we may see where they have to emit a vocal response, say please, and so that we're gradually trying to increase the complexity of the response and build up their communication repertoire. But often we want to start with that simple response so that we can control access to the establishing operation and decrease the probability that there's going to be an extinction burst. What if we have somebody that is requesting reinforcement frequently, both when we signal it's available and unavailable? Typically what we'll do in that situation is replace the multiple schedule that we're currently using with one what we call response restriction. And what does that mean? Well, if we have a picture card and we put it out, the individual can touch it and access reinforcement during the reinforcement component, and then we take that card and put it away when reinforcement is unavailable. So the card both makes the response available, but also signals that reinforcement is available. So it acts both as a response card and as a discriminative stimulus. And in doing that way, we can obviously, when we put the card away, they can't touch it, so they can't request reinforcement when it's unavailable. If someone has a vocal response, they may continue to request reinforcement when it's unavailable. We will sometimes use the card in combination with the vocal response where they have to both, kind of like handing over a token, You can say, toy please, but you also have to have the card and hand it over. And typically, they can't, when we put the card away, they can't hand that over. They quickly learn that it doesn't do any good to nag and request vocally when you don't have the card, because it's very, very salient that you only get reinforced when you have both the card and you say, toy please.
My turn to play. Good touching the card. My turn. Good touching the card, Katie. My turn to play. Nice work touching the card. My turn to play. Good waiting, and nice job touching the card. My turn to play. Awesome job touching the card, Katie. My turn to play. Good waiting. Good job touching the card. I'm gonna play now. Nice touching the card, Katie. My turn. Good waiting. Awesome job touching the card. My turn. Good waiting. Nice work touching the card, Katie. My turn to play with the iPad. Touch nicely. You need to touch the card nicely. Touch the card nicely, like that. That's touching the card nicely. My turn to play. Touch the card nicely. Touch the card nicely, like this. You do it. Good touching the card nicely. My turn. Good touching the card nicely, Katie. Katie, draw a line. Nice job drawing a line. Let's write your name. Good touching the card. You can have a break. Katie, trace the line. Nice job tracing the line. Trace that line. Good job tracing the line. You can have write your name. Good touching the card. You can have a break. Trace the K. Nice job tracing the K, Katie. Trace the A. Trace the A, like that. You do it. You need to trace the A, like that. Trace the T. Trace the T, like that. You try. You need to trace the T, like that. Trace the I. Good job tracing the I, Katie. Trace the E. Good job tracing the E. Draw a line. Nice job drawing a line. Let's draw another line. Good touching the card. You can have a break. Trace the number 1. Good job writing the number 1. Trace the number 2. Trace the number 2, like I did. You try. You need to trace the number 2, like that. Write the number 3. Write the number 3, like that. You try. You need to write the number 3, like that. Write the number 4. You need to write the number 4, like I did. Good writing the number 4, Katie. Trace the circle. Awesome job tracing the circle. Draw a square. Good tracing the square, Katie. Draw a triangle. Good drawing a triangle. Write your name. Write your name, like I did. You do it. Good job writing your name, Katie. Write your name. Good touching the card. You can have a break. Katie, trace the circle. Good job tracing the circle. Trace the square. Good tracing the square. You're doing such a good job. Write your name. Good writing your name, Katie. Trace the line. An awesome job tracing the line. Trace the number 1. Good tracing the number 1. Write number 2. Good touching the card. You can have a break.
The first critical component is correctly identifying the function or functions of problem behavior. So if we accurately identify the function of problem behavior, then we're in a very good position to manipulate those contingencies such that we decrease problem behavior through extinction, and we use that reinforcer or reinforcers to increase appropriate communication responses. So identifying the function is critical. The next thing is to very clearly train the individual to emit a simple and effective functional communication response. So selecting an appropriate response that the individual can do easily. And if they don't have any communication repertoire, we're typically going to start with a card touch response. Getting that response well established, and then the next step is to bring that response under stimulus control. And we do that, as you saw in the videos, by having a very clear signal as to when reinforcement is going to be available and when it's not available. And if we have an individual who doesn't really learn that response very well and continues to request reinforcement when we're signaling that it's unavailable, we'll typically switch to the response restriction procedure, where the card comes out when reinforcement is available and we put it away when reinforcement is unavailable. And then if we have very good stimulus control, we can try making a big jump to our terminal schedule. If that doesn't go well, then that tells us, well, we better go back and proceed more slowly and get the individual to tolerate increasingly longer periods of time when the reinforcer is unavailable. Then I think the final step is good parent training, and we do that we have them watch sessions or watch videos of our therapists doing the sessions. We practice with them using role play, provide them with feedback, and we get them so that they can do the procedures very well with our therapists acting and doing some of the challenges that their child showed us as we went through the treatment. Once we have the parent doing that with high integrity, we then introduce the child and the treatment first in our setting, and then we start to go on what we call generalization trips. We'll go to a supermarket if that's been a place where the parents have had difficulties, go to a church, a public park, that sort of thing, and really work with the parents on all the situations where they've traditionally had difficulty with their child. We'll go to the home, and usually the last week of treatment is really geared toward making it work for parents in the natural environment and or the school personnel. When we're treating behavior that is socially maintained, we produce a mean reduction in problem behavior of about 95%, and in almost all cases we're reducing it by 80% or more. So a common thing if we see when we're starting to extend that out we have a child who's just not tolerating that length of delays, we'll typically do a competing items assessment where we'll try different, say if the behavior is maintained by attention, we will have the child in a situation where problem behavior produces attention, and we will introduce competing items, their favorite toys. We'll do a preference assessment, and during this assessment, each time we put in one of these items for say 2 minutes, they can display problem behavior and get attention, or they can play with the toy and consume that reinforcer. And what we're looking for is items where there's low rates of problem behavior and high rates of item interaction, and those types of things are going to be useful for helping us to get through those periods of time where we have to have a long period where attention is unavailable. The kids that go through our intensive program, usually they're in-house for 8 to 12 weeks. Some real severe cases are in considerably longer, but most cases are in that sort of time frame. And then we follow them on an outpatient basis for about 2 years post-discharge. And it's not unusual for the child to have some bumps along the way. Somebody gets sick, the child gets sick, the parents stop doing the treatment. Parent gets sick and grandma comes in and they don't do the treatment, and we have to get involved and sometimes do a little booster session with the child or several booster sessions with the child as well as with the parents to get them implementing the procedures correctly again. Absolutely, we get very high ratings from parents on the acceptability of our procedures. And that concludes my presentation. Thank you so much for this opportunity to share this information on a very effective treatment.